So let's talk about traveling in pregnancy. How much is allowed? Should you travel? What are the precautions you take? So, first and foremost, you know how traveling is. Like, first of all, if you're traveling by air or you're traveling by car. So, the recommendations are if you're traveling more than 4 hours anywhere, just sitting somewhere, you are at risk of a blood clot in your leg, and that can go into your brain or your lung. Now, this is a very small chance of happening, and the risk is way more higher if you are like bedridden and all of that. So, for those patients, we generally would give blood thinners throughout pregnancy because a blood clot to your heart and lung can be very scary. Now, when you're traveling, especially air travel, what happens is there is really a lot of dehydration up there in the flight, and also you are like bound to a chair. So these are two factors which I want to and which I want you guys to recognize, that first of all, you're dehydrated, you feel thirsty, and they give like really less water. And the second thing is you are bound to your chair. So there are some physicians who would give a blood thinning injection to their patients, especially if she's very high risk. Like, we calculate a risk for patients to have thromboembolism depending on their risk factors. So if you're someone who has had a lot of kids, or who is elderly, who's like more than 35, who's overweight, BMI is more than 30 or BMI more than 40, or you have had risk factors as in you yourself have had a blood clot in your past, which has caused a swelling of leg, redness of legs, and you needed blood thinners, or you have a significant family history of people who have gotten blood clots. So you will know you are one if you've had that history. So if you are confused about it, like, do you think that, oh, this happened, that happened? No. These patients who get blood clots, it's a very life-threatening conditions, and they either pass away or they are given lifelong blood thinners in the form of tablets or injections. So if any of you have not received or doesn't have a significant history of a blood clot in pregnancy or on a pill or something, you are safe. But yes, if you're traveling even by car or by plane or by boat, whatever form of traveling you're doing, remember to do two things. Number one, hydrate yourself. It's very important that, because in flights, there are just like 2-3 flight attendants, they will give you these teeny tiny bottles, and then you're not going to be like hydrated enough, because if you're dehydrated, that's when the blood clotting risk increases, especially with being bedridden. Not bedridden, but being in the plane bound to a chair. So drink enough water. And what I would do is, like, after I have checked in, like, obviously you can't take water with you in the cabin. So after you're done checking in, that is one thing I invest in. Like, I buy a lot of water bottles, or I carry empty bottles, and then you can fill up the water from a safe water dispenser, and you can carry that water with you in flight. So remember to hydrate yourself, and if the air hostess is coming in regularly, just ask for that. Hydrate yourself. Now, second of all, you need to use tight stockings. Like, you can get air travel stockings in the pharmacy, or you can just wear like a very tight stocking. These are specific stockings, especially if you're going to travel for a long time. Wear it so that the blood doesn't, like, your legs are like squeezed sort of. So if you feel very uncomfortable wearing the whole tight, just get something which is below knee or little bit above knee, especially if you have varicose veins and stuff. So you can use those sort of things. High-risk patients will also get aspirin sometimes, depending on your doctor. We don't really give it to everyone. Regarding the safety of whether you can travel in pregnancy, if you're not having any pain, if you're not bleeding, you're not leaking, your baby is moving fine, you have no complications in pregnancy, then it is safe. Most airlines will allow you to fly up to 36 weeks. Now, be careful. This is dependent on airline to airline. Some airlines don't allow after 28 weeks. Some airlines would want a letter and all of that. The letter should say that you are one baby only and this is your due date and all of that. But none of that matters if they decide to not let you fly. If they think that, something is wrong with you, they're not going to let you fly. And if you still insist to fly, they will always ask you to sign a waiver that if anything happens to you on the flight, you land anywhere, all that expenses would be borne by you, and that child is not going to be because if the child is born on the flight, they have to give the free air travel to this kid for lifetime. And they don't want to do that. So that's why they don't let you travel. So I hope this is enough when it comes to traveling. And of course, there are so many more things about traveling that I can talk on and on and on and on. But if you have any more fears about traveling in pregnancy, please come on a coaching call and get that thing sorted.